Gauteng Health says over 2,000 operations have been cancelled or postponed at Maxeke Academic Hospital between 2022 and this year. The department says load shedding, a lack of funds and resources have forced some of these cancellations. Let's get a better sense of what's actually taking place and perhaps what the way forward looks like. Bringing our guest, Professor Alex van der Heever is the chair in the fields of Social Security Systems Administration and Management Studies at Wits School of Governance. We're also joined by Prof Martin Smith, who's the clinical head of the Department of Surgery at Chris Hani Baragwanath Hospital. To both our guests, it's lovely to have you on the program. Thank you so much indeed for making time. Professor Smith, I wonder if I can begin with you with a bit of context. We're told about 2,000 of these operations typically have been cancelled at this particular hospital, but out of how many during this time do you reckon typically would the hospital be able to perform?
So thank you and morning to all. So I think that the context of this is really has to be seen in the context of COVID, but also in previous unmet need in terms of surgical care in the region and in the country as a whole. So there's always been an unmet need for surgical care, and that's because we believe that regional and district hospitals haven't been able to perform optimally and to perform the kind of surgery that they should be able to do. When COVID pandemic arrived, we had to repurpose, and I think it was appropriate. We had to repurpose facilities, reprioritize, and that increased the waiting list and the backlog in surgery because we could only perform really essential and emergency surgeries. So this is still the legacy that we face now from that period of time. So I think that the numbers are significant, and I think that the issues that we can find some solutions to this, but at this point in time, I think we haven't really done the best we can as a health facility or as a health fraternity to address this issue.
Yeah, and that's the thing, Professor van der Heever, isn't it? You know, before we start about allocating more resources to the problem, the question really is, are we using the resources at our disposal optimally to begin with?
No, not at all. So if you look at the same period, Groote Hospital has just eliminated its backlogs in surgery under the same conditions as Gauteng, post-COVID, also dealing with load shedding, also dealing with the same fiscal environment. They've eliminated it because they're actually a very capable province on the whole, and there's generally good governance. Now in Gauteng, a large part of the budget has been stolen. If we look at the Tembisa issue, we also look at the cause and the investigations around the fire at Charlotte.
Right.
All of these indicate a serious problem with governance in the province, and that's where a large part of the money is going. There's also a very, very poor leadership that is selected and appointed at the top of very, very complex organizations, these hospitals. And all of this leads to the fact that we've got hospitals that are really poorly run with very poor managers in charge and what appears to be institutionalized corruption.
And you're right. I mean, we really are spoiled for choice in Gauteng, aren't we? As you're speaking, I'm reminded of Professor Malekapuru Mahoba's report into what's been taking place at Rahima Musa Mother and Child Hospital. And even in that report, he goes on to mention that, you know, the issues are not just about a lack of resources, for instance, in the wards themselves, but there's also very serious vacuums at a leadership level, which raises questions around the people who even appointed them at a provincial level, so to speak. How much of an issue, Professor Smith, is this when it comes to also making sure that we clear these backlogs at hospitals like Maxeke?
So we're in the process of completing a study that we've been looking at what we call theatre utilization in the southern part of Gauteng. So that's all the regional and district hospitals that refer to Chris Hani Baragwanath Academic Hospital and Maxeke Academic Hospital. And we've identified the gaps. So these gaps, I think, reflect everything that Alex has just said and what you've reflected on. But clearly there are areas where we could do much better. It requires good leadership. It requires better allocation of resources. It needs us to improve infrastructure and equipment in these facilities. So, by example, we identified that there are probably just under 30% of the operating theatres in this region that are not being utilised at the moment. And the reasons for those are numerous. Lack of nursing. I mean, we've heard recently the problem with training of nurses, and operating theatres need specialised theatre nurses, and they're just not available. Infrastructure, the equipment, the air conditioning, all those kind of things, lighting, all those are reasons why these operating theatres are not functional. Now, are these solvable problems with good leadership? I think they are. And I think that the frustration is that they're not just being addressed. And that probably is just a reflection of the bigger issues that Alex refers to.
Yeah. No need to overstate, of course, that lives are at risk in this context. I imagine many of these elective surgeries are manageable at the time at which they could have been performed, but the longer you wait, the worse it gets. Professor van der Heever, is it even an option to rope in, for instance, the private sector and use their capacity at least to clear this backlog, or is that just not a sustainable solution?
Well, it poses some fiscal risks, which you'd require a very capable department to be able to manage, because they would have to enter into an agreement. If we go back to the COVID period, Gauteng was unable to establish any kind of coherent agreement with the private sector to manage public sector patients in the private sector during that period. Again, the side-by-side comparison, the Western Cape established those contracts but ultimately never needed the private beds. So this is, so I don't think the private sector is entirely a solution. The failure in the infrastructure side is because the Department of Infrastructure Development in Gauteng doesn't appear to be able to get its budget to hit the ground in the health system. And if we look at Charlotte again, where the fire occurred, I just want to emphasize the impact of poor governance. That fire, a forensic assessment indicated that that was arson. And there's been no follow-up to work out why there was arson and whether or not the fire was entirely to hide the corruption associated with the PPE investigations at the time. But since that period, Charlotte hasn't actually been repaired sufficiently for large parts of the hospital that were affected to be functional again. Now, that is years now since that happened, and it's still, there's no finality. Now, this is systematic. The failure of the infrastructure budget to hit the ground in the Gauteng Department of Health is across the board. And there's no logical reason for it other than that people are essentially, they've got fingers in the till. And that there's a lot of people conspiring to access the infrastructure budget. And what's very clear from the Tembisa investigations done by News 24, which are made public, is that there are significant syndicates operating, and a lot of people that are being paid for transactions for goods and services that are probably not even being delivered to the province. And this is on a massive scale, not small, but massive. Yeah. And the people that basically indicate that this is occurring get assassinated, and the rest of supply chain management freezes. So the practices are widespread. The failure to investigate is indicative of very, very senior level corruption. And the people that are appointed into the positions that are overseeing this procurement are letting this happen. Yeah.
The question, of course, is also what impact is this having on the medical practitioners who are choosing to stay in the public sector, not because of a lack of opportunities on their part, but because of essentially how they feel about their jobs. And perhaps, Professor Smith, you could speak to us about this. The impact it's having even just on morale for staff who are trying against hope itself to continue working, in a context where it feels that people deliberately working against their efforts.
And I think it's absolutely correct. So we came out of a very difficult time with COVID, where healthcare professionals took really a lot of the stress, and there was a lot of, I would say, mental issues with many of our healthcare deliverers. And we came out of that, and then we go into what we're dealing with now. I think that there's a strong sense of despondency. A lot of people are asking questions about why they're there and what they can actually do, and are their skills being used to the best effect. So surgeons are asking, if I can't operate, then what does it mean for me as a surgeon? So I think that there really are serious consequences to this failure, and it really has led to significant despondency amongst the professionals, particularly I can talk for the surgeons. It's a real problem.
Yeah, and may we never tire of shining a spotlight on this issue, which is why we've decided to have this conversation with the both of you today. Thanks very much indeed for giving us your insights today. Professor Martin Smith is the clinical head of the Department of Surgery at Chris Hani Baragwanath Hospital. Also joining us there is Professor Alex van der Heever with the Wits School of Governance. To both of you once again, thanks very much indeed.